Good evening, everyone. I'm Krista Lundy. I am the Executive Director at the Meadville Chamber of Commerce, and thank you so much for coming to our Sweetness of Aging seminar series. We've had numerous seminar series here at Active Aging, so a big thank you to Active Aging, the Lou Davies Community Center, for hosting these for us. We greatly appreciate their support of the program that we're having, and they do have many, many services here offered for you as you age at any age, so be sure to check out things that they have here as well. They've helped us out in previous seminars, and they'll be helping us in future ones as well, but a big thank you to them. But this evening, I'm very pleased to announce that we have numerous topics that we have discussed, and this evening's is transitional care or personal care in your home, and we have many options in the Meadville and surrounding communities, but many of these businesses are chamber members, and I'd like to feature a few of those folks this evening to tell you a little bit more about the services that they each specialize in, what they offer, and specific details about each organization. So I know that you'll learn something this evening. All of the people that are speaking do have their contact information, or you can always contact me at the chamber office to get their information, and you are more than welcome to ask them questions afterwards. But each of them will talk briefly about their own organization, and then we'll move on to the next speaker. So at this time, I'm pleased to introduce Michelle Peters. She is the Care Cottage Coordinator with Help at Home with Westbury. So thank you, Michelle, for joining us.
Thank you, Krista. Hello, everyone. Like she said, my name is Michelle. I am with Westbury. I am in the Help at Home with Westbury division. We provide in-home healthcare services, companionship. We can set up, lawn maintenance and transportation to and from appointments, things like that. But tonight I am here to talk about our Care Cottage program. Our Care Cottage program is very successful. It's been very successful over the past few years, and we've grown. Right now we have 7 care cottages. In the near future, we are planning on opening up some new ones in the Meadville and surrounding area. At the moment, we have 3 cottages in Meadville, we have 1 in Cochranton, and we have 2 in Titusville. All of those cottages house 3 residents, up to 3 residents, and some are all female. We have 1 that is co-ed. We have 1 that has a married couple, so we really try to reach out and accommodate as many people in the community that we can. Each resident has their own bedroom. They can bring their own furniture, TV, dressers, beds, things like that, just to allow their experience to be as comfortable and as home-like as possible. We are allowed to, or able to provide cable, internet, phone services as well. It's all part of the room and board. The shared living areas are fully furnished. We go in there, we decorate them, we provide sofas, recliners. We can look into if the residents need a lift chair and they don't have that, we can help and try to coordinate that and get that set up for them. There's patio furniture outside, dining room table, anything like that. All appliances and everything are included. We encourage family and friends to visit them as they wish. At their convenience. We welcome them on holidays and birthdays and things like that. We had a 75th anniversary for one of our couples, and they kind of had a little get together and things like that. So we really try to encourage it to be an in-home setting and allow them to come and do and as they please and like they would at their home. Each cottage is located within minutes of medical facilities, also within shopping areas. So we've had, if a patient wanted to go to the grocery store on their own, and we have, the transportation set up for them, we try to do that. So we encourage them to be as independent as they can. We do provide 24-hour care 7 days a week within the cottages. So there's always someone there, a trained caregiver that we make sure that they are trained on all levels of care, whether that just be basic companionship up to, hands-on and personal care and things like that. They are trained on all levels of that. Personal care, medication management, meal preparation, housekeeping needs, those are all provided daily for the residents. We can assist in setting up medical appointments, help in planning activities and outings with the family. A lot of times the family will have different things, and we make sure they're up and ready and remind them where they're going and things that they can set up, or if they want to go somewhere or meet someone. We do our very best to make sure that that all happens. We encourage and support them any way they can so they can maintain their dignity. Our services allow for patients to be as independent as their level of care provides or allows. Some of the patients enjoy helping with meal preparation or decorating for holidays, planting flowers in the spring. All of our staff is fully aware of these are things that, encourage them and make them happy and keep them going. So we permit them to do that or allow them. So a lot of our ladies bake around the holidays as well, depending on the care level. Those that may not have full capabilities or physically and things like that, we still encourage them and try to include them on that. So, by allowing them or having them suggesting sitting at the kitchen table while someone else, would be doing things like that, or sitting on the front porch or back porch while they're planting or gardening or things like that. We operate on a natural awakening schedule, so it really is comfortable for them. So they can go to bed when they want, they can wake up when they want, and then we can kind of plan, their day and their medicine or, their schedule around that. So say they awake around 8 a.m., the early risers, we can start with their meds at that time and go from there. Say they don't want to wake up until noon, we can plan their, obviously, physician permitting, depending on their medications. As the Care Cottage coordinator, it's my duty to coordinate and maintain the safety, comfort, well-being of the structures, grounds, visitors, and staff. So I'm there to make sure that the landscaping is kept up like you would in your own home, and making sure everything is safe. The walkways are all taken care of and safe. Things like that, allowing and ensuring visitation from family and friends. I'm basically like a middleman. I can serve as that in between the patients and families. So we always are on the same page and communicate and make sure that the top level of care is provided for them. We do maintain compliance of all federal and state regulations and all care procedures at all times. We communicate with the family members on a routine basis. So if a patient comes in and they're having a little bit of health issues, we can call and let the family know, hey, so and so, we went to a doctor's appointment today. This is kind of what they said. This is what they would like to see. So that way, everyone is very involved, even though the residents may not necessarily be living, in their home or they may not have direct access there. We can at least, or if some of the residents, develop, dementia, things like that may hinder their memory, things like that. We're there to help communicate all those things for the patients. Any problems or concerns that arise within the cottages, I'm there to help and make sure everything gets taken care of accordingly. We love what we do. I mean, we really consider our patients family members, so we're there to help them and encourage them in any way we can. So, all right, thank you very much.
At this time, I would like to introduce Selena King. She's the Regional Marketing Manager for Life Northwest PA. Thanks, Selena.
Good evening, everyone. I am the Regional Marketing Manager for Life Northwest PA, and so I cover here this area in Crawford. And also Mercer County. Life Northwest PA, our acronym, is Living Independence for the Elderly. And so the reason why we have that acronym is because we are part of the National PACE program, which is the Program for All-Inclusive Care. And most of you know the PACE program in Pennsylvania is a prescription drug program. And because it's that, we can't call ourselves PACE because many people will be confused with that. And when we go out into the community, when we tell people that we are all-inclusive and we're PACE, people confuse us with the prescription program, drug program, and that's not who we are. And so that's why we are called Life. And so there are more than 30 some programs in the state of Pennsylvania, and they are still growing. And so even here in Northwest Pennsylvania, we have opened here in the Crawford area as of October 1st. We are located in the Grove Street Meadville Medical, as most people here know in Meadville as the former Spencer Hospital. And again, we've been there since October 1st. We opened in Mercer County in downtown Sharon in March 1st. And we have been in Erie County, there in the center of Erie, and we've been there since 2007. The PACE model has been around nationally since 1970. And so it's been a model that has really worked. It has a holistic model. It really wraps around an individual, and it really becomes family for people in our aging community. What really works for the program is because we're really there for our aging community members. They know who we are, we know who they are, and we know what they do pretty much every single minute of the day. They can always reach us, we can always reach them. And so one of the things that really stands out for them is the medical care and the team that really sticks behind them in our monthly and daily meetings that we have for them. One of the things that we do is called the IDT, which meets every day, Monday through Friday, and that's called the interdisciplinary team. And it's made up of 12 disciplines, which includes our medical staff, which is our physician, who becomes the primary care physician of any participant that is in our program. And it also includes our registered nurse, who becomes part of the program as well, and she's able to make any visits and anything that the doctor cannot do. It also includes our transportation coordinator, who is able to coordinate any visits that need to be picked up for any of our participants from their home to the center, and also to any of their appointments that they need to go to. And we've recently added Walmart visits as an added plus to the program. Due to federal guidelines, we have not been able to do any more outings as we have done before, but we've been able to add Walmart to that to make sure that our participants are able to get some of the daily necessities that they need to have their normal continuity of care and that their daily lives aren't interrupted. We also have an activities coordinator that's on the team, because our activities change every hour on the hour, and they're different every month. The great thing about that is it's not just bingo when you come to our senior center Monday through Friday from the hours of 8 to 5. A lot of people think when you go to the senior center that you're just going to play bingo all day and you're going to just crochet or sit in the corner. Our people are very active. We have a participant council every month, and so people weigh in the good, the bad, the ugly, and everything in between of what they want to hear and what they want to see. And so the program is really theirs, and it's tailored to their needs and what they would like to see. Also on that team is our physical therapist and our occupational therapist to ensure that everyone's needs are met with physical and occupational therapy. We also have our dietary staff on that team. Our center manager from each of our centers is on there to make sure that the daily operations are met, and also to talk to the team to see if they're seeing anything that's happening with our participants. Also on there would be our Beyond Our Care coordinator is our PCA coordinator, who makes sure that all of our staff that's working directly with our participants, because we have a 1-to-7 ratio with our participants. It is actually 1-to-1 if we have different colored lanyards. So if you are a fall risk, or if you have dementia or Alzheimer's or anything that needs more one-on-one care, that'll be 1-to-1. But anyone else that is more able-bodied and can go around on their own, it's a 1-to-7 ratio. And we also have other individuals that are involved that I'll meet daily to discuss what has happened in the last 24 hours. So anyone that has been in the hospital, our clinic manager is on there as well, that meets with also the regular nurses that are in our clinic. We have a clinic in every center that if you have to go and see somebody, most of us can't see our doctor if we call and wake up in the morning and aren't feeling well. The beauty of life is if you're not feeling well and you don't can't get into your regular, you get to see us. You get to come in, you can call 24/7, you're going to talk to one of us. You're going to talk to someone who knows you, who knows your profile, and they're going to be able to see you within 24 hours. You can come right into our clinic. We can do everything up to an IV right into our centers. And then anything outside of that, you're going to go into any hospital that is within our network. We have contracts with UPMC Horizon out in Greenville, UPMC, we're working on one with UPMC Hammett out in Erie. We have one with Allegheny, which is St. Vincent's in Erie, and also here Meadville Medical Center here, and also Meadville Medical Center that's out in Titusville. We will be opening in Warren County as of October 1st, and so we'll be working with them and the PHN network there. And so we are growing. We will be in basically every part of Northwest PA that you can think of. Clarion County is our next place that we will be going to in the next year. And the great thing about also Life Northwest PA is part of the community health choices. I'm not sure if most of you have heard about that. Life is actually one of the choices that you get to choose. You will have your main providers such as UPMC for you, United Healthcare, and the others, and then another one that will be in the drop down, which we are already in when you go into Compass, will be Life Northwest PA. And so you can choose for us to be your provider because we are also the healthcare provider. We provide everything for your healthcare with no copays. We don't take your money from you. Because we are funded from the federal government, the state does not give us anything. So we provide your medication. We provide any ambulatory accessories that you need. So if it's a walker, if it's a wheelchair, if it's a motorized device, we provide those things. And the IDT team that I talked about, they get together and they talk about your needs with you and your family to discuss what's going to be in the best interest for you. You also have the ability to appeal things if you feel a decision wasn't right for you, because your rights are posted in every inch of our centers that you can find. We work for you. Without you, we don't have a center, we don't have a program. And so Life is pretty much there to serve the needs of our aging community, as we know that there is a huge population of baby boomers that will be coming along, and so we're here to serve that population. The federal government stands behind us, and we are a federally funded program to serve the needs of that community as we transition into that portion of healthcare. We also help with if there's respite care that happens. Also for those who look into those as you transition into the next level of care. If there's something that happens and you need to go into a nursing home, our goal is to keep you out of the nursing home. However, if that need arises, Life helps you with that situation as well. Here in the Crawford area, the center manager, her name is Cindy Schofstall. She's available to talk to you, as well as Nicole Courier, who is also the clinic manager, who's a registered nurse. We do many activities here in the community. You may have seen us out with our trailer that we do. We have a marketing trailer. We do all kind of events. We would love to have you come and tour. We love to do lunch tours. We love to have people come and visit and see the center. We do have a beautiful center. And people who have been in the program and have actually benefited from the program, most people talk about the range of motion has increased since they've been in the program with their physical therapy, or their speech has gotten better since they've been part of the program. And these are testimonials from people who've actually been participants in our program. It's not something that we've asked them to say, it's just their own experience. And so I just ask you to give us a chance. My card is in the back. We have brochures that outline more of what we do and more of what we can provide for you. Just wanted to take a few minutes of your time tonight to tell you about our program. And if you have any questions, feel free to take my card and give us a call. Thank you.
Please help me welcome our next speaker will be Colleen Miller, and she is a physical therapist with VNA Alliance. Welcome, Colleen.
Good evening. My name's Colleen Miller, and like Krista said, I'm a physical therapist with the VNA Alliance. I've worked in actually the community in physical therapy for 27 years, and 25 of that has been spent in some form of home care. So I've had a lot of experience. Our agency, the VNA Alliance, I feel like it has a strong presence in the community. We partner with Westbury, St. Paul's, Meadville Medical Center, Concordia Visiting Nurses, and Grove City Medical Center. So we service areas of Crawford, Venango counties, and Mercer County. I'm here today to really talk about our skilled services. We're founded on nursing, but we also provide physical therapy, occupational therapy, and speech therapy. Physical therapy, our role there is to get people moving, obviously, with their getting out of a chair or their walking mobility, and trying to provide exercises to reduce fall risk, since that can lead to certainly injuries and hospitalizations. Our occupational therapists in the home setting provide activities of daily living retraining. So that would include bathing, dressing, and personal care. They assist with getting people back to their independence with those living skills. Our speech therapy therapist, she'll help with memory. She'll provide certainly support if an individual has some swallowing difficulties and speech difficulties. So we provide those services. Our team of therapists, we're experienced clinicians, and we have actually most of us have at least 20 years in the home health arena. So that says a lot. So I feel, we are, okay. Sorry, I'll take it. Okay, so I wanted to make a point that research has suggested that an individual is 6 times more likely to return to the hospital in the first week after discharge if they are walking less than 700 steps a day. So obviously our role here is to get people moving as quickly as possible following a hospitalization. So what I wanted to do is to just share an example of that continuum of care with a patient I had recently. He had come out of the nursing facility. He was pretty debilitated still yet when he came home. So we were ordered in some nursing and therapy services. He was definitely motivated, very motivated to get back to his previous level of function. So we came in, we provided some strength building, some endurance training. We gave him a pedometer to track his daily steps, and that provided some motivation for him, and he would track that distance every day to see his progress. And so over time through our care, and that was 2 to 3 days a week, that we would come in and see him for some exercise and some training. He was able to go from like 100 feet of walking to 1,000 feet of walking, over 1,000. He is able now to leave his home for short periods of time. It is, he has been able to resume some of his activities of daily living. It has improved his quality of life, and it's also reduced the burden of care for his wife and family. So it's just a good example of how we can help at home. So our goal is really, our aim is to provide a restorative level of care to get people moving, certainly reduce hospitalization, readmission, and then get to a maintenance level of care where they can maintain it through our help or through the help of their family or caregivers. So thank you for giving me the opportunity to speak.
And Colleen mentioned a very good point about how involved they are in the community. All of the businesses and companies that are represented this evening have been and continue to be involved, not only in the community, but with the chamber. And I thank you all for that, because as I look down through this list, Michelle Peters with Help at Home, used to be family-to-family home health care, now at Westbury. Westbury is very involved with the chamber in many aspects of the business. Life Northwest PA, we did a ribbon cutting grand opening for them when they had their ribbon cutting grand opening. Colleen is talking about the VNA Alliance, and they're soon to have a new location, and we'll be doing a ribbon cutting grand opening for them as they're involved. Our next speaker is Lisa Bailey, and she is the owner of Home Instead Senior Care. And when they opened, they joined the chamber before they even were open, and we went and did a ribbon cutting grand opening for them at their location in Vernon. And then our last speaker, Terry Carney, who is with Interim Healthcare. She's the transitional care coordinator there. We did a ribbon cutting grand opening for them, and she's very involved with the chamber. So all of you have been very involved with the chamber and are involved with the community, and I appreciate all that you do. And it happens to be all ladies speaking tonight, so thank you so much, ladies. But at this time, Lisa, I would like to introduce you again. Lisa Bailey is the owner of Home Instead Senior Care.
Thank you, Krista. As Krista said, I'm Lisa Bailey. We have Home Instead Senior Care out on the Conneaut Lake Road. Home Instead is a franchise. There are about 1,500 Home Insteads all over the world. The United States, every state is represented, almost every county in every state. So we take care of Crawford and Venango counties that are here in PA, and we provide in-home care for seniors. That could be at times in care centers, at the hospital when needed, and in individual families' homes. As you can see from the poster over here, that would take care of anything from meal preparation, light housekeeping, med reminders, shopping and errands when needed, and transportation, personal care services, and companionship. And that's just a few of the things that we do. Like a lot of you, I'm getting to the point where I'm faced with the same situation from the daughters and the sons that call on a daily basis thinking, what do I do now? My parents have been home. They have been independent for a very long time. Now I'm not sure that they're home safe and independent. So what can we do next? So typically a referral may come from a doctor's office, a social worker at the hospital, sometimes a hospice agency, a neighbor. I once had a 94-year-old woman not call for herself. She did not need any services, but her 94-year-old friend did. So our referrals come from all kinds of places, but it's very typical for a daughter or son to call who may not live in the area and say, what can I do now? Can you help us? So we go in and we offer support for that family. It may be 3 hours a day. It may be 24 hours a day, and anywhere in between. There are times when we've gotten called in to do a standing lab visit at the hospital. So every Wednesday, our caregiver will come and pick up a gentleman in Linesville, let's say, and take them into Meadville for a standing lab appointment. And on the way back, they choose some things to do. Sometimes it's the post office or the recycle center. Sometimes it's to the grocery store and so on. They go home and maybe play cards, take a walk, do a couple activities, and that's it for that level of care. Other people need a lot more than that. The daughters sometimes can take care of evenings with the parent or the parents, so our caregivers are there all day. And vice versa. Sometimes a family member's there all day. They go home to stay with their own family in the evening, so our caregiver will come in and spend overnight with a family member. So the level of care can be anywhere in between. We are non-medical. So in that case, we work right alongside with visiting nurses, interim sometimes. It may be occupational therapy, physical therapy, or one of the hospice agencies may be in the home. We work right alongside offering that support, helping the family members when they can't be there. So that's basically what we do with home care. It can be short-term when somebody comes home from a hospital stay, a hip replacement, an injury, an accident, an illness. a knee replacement, we come in and we can be short-term, where we stay for a couple weeks and then we taper off, and then we maybe come in only at night, and then we taper off that, and then it's just a few hours a day. And then sometimes we laugh and say that our clients graduate from us. So at that point then we touch base if anyone needs us, and at times we've come back to the same client. A new injury comes or a new illness, and we start back with the same client. Other clients were a little bit more long-term. We may be providing 24-hour care for some people, where one caregiver stays and the next one relieves them, and so on. And that's a great experience. It allows the family member to stay at home for a longer period of time and live as independently as possible in their own home. So that's basically what our in-home care consists of. Thank you.
It's very nice to hear that a lot of you actually work together in this industry as well. As you mentioned, you work with some of the same people from the room, so that's great to hear. Our last speaker, please help me welcome Terry Carney. She's the Transitional Care Coordinator at Interim Healthcare. Thank you, Terry.
Hello, everybody. Like Krista said, my name is Terry Carney. I am the Transitional Care Coordinator for Interim Healthcare. Basically, my job, in a brief nutshell, is I go into a facility or a doctor's office or a hospital, and I make sure that all of your services are set up before you go home. And it could be something as simple as an exacerbation of your COPD that landed you in the hospital. It could be congestive heart failure, or it could be that maybe you're having a little bit of trouble with dementia or Alzheimer's and you might need a little bit of help when you go home. Interim Healthcare is a franchise, much like Home Instead, and we are located actually on 322, right across from Eddie's Footlong, seconds from our friends at Home Instead. The nice thing about Interim Healthcare is it is a one-stop shop. We have both skilled and private duty services. We always like to say that we cover everything from birth to 150 years old. We can do short-term, long-term, we can do skilled, we can do private duty, we do all the waiver programs, we do all the insurances in the local area, and it's a pretty large area that we cover. We cover all the way down into Mercer, and once in Mercer, we're no longer able for resources. We have a Pittsburgh office that connects to us, and then we go all the way up to Lake Erie, over to New York, and all the way to Ohio. Pretty large coverage area, and it's a lot of big work to do, but I do have friends in Erie that help me out with the Erie part. So that's just kind of a brief idea about what Interim Healthcare does. One of the main things that we do just a little bit different or differentiate us from other services is, again, we do have contracts with all the waivers. And one of our main focuses is on our veteran population. We do a lot of work with the Veterans Aid and Attendance Waiver. It's a program that I get a lot of phone calls from family members about, who do we go to? What's the next thing we're going to do? Mom, dad, grandma, grandpa, whoever needs services in the home, but we really can't afford to pay for it. What do we do? And that's my job as the Transitional Care Coordinator, to find money for you guys. A lot of people don't realize that they may qualify for PDA waiver. PDA waiver is a service that here at Active Aging, they get the families connected. They do all kind of the groundwork to make sure that they qualify. There's two different programs under that, the options and the PDA waiver. And the options waiver, you can have a little bit of a higher income bracket and still qualify for it. It's not going to be a lot of hours a week, but it is something. Even that peace of mind, a couple hours a day, a couple days a week, would help people and give a little bit of respite to the families. They also have the PDA waiver, which can be all the way up to 24/7 care, depending on how much you qualify and what the need is. With that, we do have to have a nurse supervision. So all of our private duty business is all nursing supervised, meaning that a registered nurse needs to come out and evaluate you every 60 days. They need to come and check in on you, see how things are going, make sure you're meshing well with your home health aide or your CNA. And so that is kind of a differentiator, is that we do have a Medicare license, so therefore we have to have a nursing supervisor in place. We do have 24/7 on-call nursing too with that program. So basically, if somebody wasn't feeling well in the middle of the night, don't want to bother their PCP, don't want to rush out to the emergency room because they don't think it's that bad, our nurse can come to you. And they'll come out and they'll do an assessment and then help you decide what are you going to do. Could this wait until 9 o'clock in the morning when your doctor's office open? Or do you really need to go to the ER? A lot of times they can troubleshoot over the phone, but most of the time it warrants a visit. We can do all sorts of many different things in the home. We can go out and prevent somebody from going to the hospital because they have a UTI. And it's something that you don't have to rush to the emergency room for. We can have a nurse come out and draw your urine and check it and get you on a broad spectrum antibiotic at Saturday at 9 o'clock at night. So those are some of the things that we can do in the home to kind of differentiate ourselves from other people. One of our main focuses is successful living. It's basically what everyone else has been telling you tonight, and that is making sure that you stay home as long as you possibly can with as much or as less intervention as you can possibly get. We focus on some of those very tough disease management: diabetes, congestive heart failure, COPD, balance and falls issues, Alzheimer's, dementia. We have actual programs in place, pathways that we follow. Everyone's opened within 24 hours, and then we get out there and we start taking care of you. We work hand in hand with your PCP to make sure that that's the direction they want to go in. Make sure that they know every aspect of your care, as well as your family members and folks that you want involved in your care. Some people want their neurologist to know on. I even have people who want their chiropractor to know what's going on. That's okay, we'll do it. We'll make sure that your chiropractor's on board with the type of care that you are having. If there were any questions that you guys have, please feel free to reach out to all of us. We're going to be here for a little bit longer to see if there's anything we can do to help you guys. We do have brochures on all the tables, lots of goodies for you guys to reach in and grab. And I just want to thank you very much for your time and my opportunity to explain a little bit more about Interim Health Care. Thank you.
I just wanted to add something, if that's okay.
Come on up.
Not really.
Sorry, sorry.
But,
From Active Aging, please, Krista, give us a few words about all that you have here to offer. Thank you for having us.
I just wanted to add, since our friend from Interim did bring it up, Active Aging does do a lot of the groundwork that you're talking, or that these groups are talking about. It's very hard to navigate this system and know what you qualify for and what your loved one really needs. And sometimes it's very hard from a family member's perspective to tie in what you see with what they're actually going through on a daily basis. And we do have staff that will come out, do an assessment, determine what level of care they need to maintain themselves in their homes, and then work with you to determine, you and them, to determine which group can best meet your needs. And we really don't steer anybody any particular way. We have no vested interest in doing so. We just basically give you an outline of what it is that they need to maintain themselves in their homes, and then let you have an idea of who's available to provide that. So I just wanted to throw that in there. So,
Thank
okay?
you. Very glad that you did.
Thank you.
I know I learned a lot about several different agencies this evening, so thank you to all the ladies for speaking to us. We really have a lot of options here in Crawford County of experts in their own area of expertise, and it's nice to hear how well they work together. That's just the big thing that stuck in my mind through this evening, is seeing how well each of them work together. So thank you for those of you that are here. If you have any questions, you are more than welcome to see whoever afterwards. They do have some information for you. Anyone at home watching this later, you are more than welcome to call the chamber at 814-337-8030 or stop at our office at 908 Diamond Park in Meadville to get information on any of these organizations that are here. So thank you so much for being here, and look forward to seeing you next month.